Welcome to Vidyanta's online courses, where you have the opportunity to learn the latest practical clinical skills used by healthcare professionals for providing the highest level of patient care and satisfaction.
In this video, a nurse will understand the various aspects of fall risk assessment and post-fall assessment. Its purpose is fall risk assessment scale, steps of procedure, and most importantly, what to do when things go wrong. In other words, common clinical errors. Fall risk assessment is an important element of patient safety. It is the sixth goal of the International Patient Safety Goal. Fall risk assessment scale is used to assess the level of risk of fall in patients. It could be low, moderate or high. If the patient comes under the high risk for fall, then the healthcare provider or a caregiver should plan a strategy to reduce the risk of fall or the chance of injury. Purposes of fall risk assessment scale: to early identify the risk of fall, to prevent the patient from fall. Most fall risk assessment scale. It is the most common scale which is used to identify the risk of fall in patients. It is used at the time of initial assessment when the patient got admitted to the hospital. At the time only, we can just identify the risk of fall in the patient, so that with the initial stage only we can plan a strategy to reduce the risk of fall or the chance of injury in patients. Morse fall risk assessment scale. In Morse fall risk assessment scale, we have 4 columns. First, serial number. Second, variables. Third, numeric value. And the fourth, score. Let's start with the variables. If the patient is having history of fall within last 3 months, then numeric value, yes 25, no 0. If the patient having secondary diagnosis such as diabetic mellitus, hypertension, etc., yes score would be 15 and no 0. Third, ambulatory aid. In ambulatory aid, we have 3 options. First, none, bed rest, wheelchair, nurse assist. Then the score would be 0. Second, crutches, cane, walker. If any of these are used, then the score would be 15. And the third, furniture. If furniture is used, then the score would be 30. Intravenous line or haplock. If intravenous line or haplock used, yes score would be 20, no score would be 0. Gait. In gait, again we have 3 options. First, normal, bed rest, immobile. Then the score would be 0. Second, weak. If it is weak, then the score would be 10. And the third one, impaired. If it is impaired, then the score would be 20. Mental status. In mental status, again we have 2 options. First, oriented to own ability, then the score would be 0. Second, forget limitation or overestimation, then the score would be 15. Total score. If the score is between 0 to 24, then there is low risk of fall. If the score is between 25 to 44, then there is medium risk of fall. If the score is between 45 and above, then there is high risk of fall. In some hospitals, Morse fall risk assessment scale is used in some modified version, and in such situation it is known as modified Morse fall risk assessment scale, in which they had added a patient who are under the age of 18 years, above the age of 65 years, and the patient was admitted in ICU, HDU or emergency. They all are considered at the high risk for fall.
Hello sir. Good morning, sir. My name is Robi. I am your assigned staff nurse from 8 a.m. to 2 p.m. May I know your name? Okay. So may I check your wristband? Just a minute, sir. Right. Mr. Nikhil Nathaniel, UHID number 123456789. All right, sir. Sir, I need to check the fall risk assessment such that we could prevent you from the fall, and it is our responsibility too. Okay. So I will ask you some few questions. So you just need to answer it. Honestly. Thank you, sir, for your cooperation. Okay. So do you have any history of fall within last 3 months?
No, not exactly fall, but yes, I did felt like getting heavy
Okay.
few days back. when I
So
got
no
admitted.
fall.
No.
No fall within last 3 months.
No.
Right. So it will be 0. So do you have any secondary diseases such as hypertension, diabetes or asthma or something like that?
Yeah, I do have hypertension since last 2 months.
All right, sir. So you are having secondary diagnosis, so I will score you 15 for that. Sir, I think that you are not using any ambulatory aids as I cannot see the crutches, cane or walker here. So you can walk by your, no? So I will score it 0. I can see that IV line is going on. It is stopped right now, but still it has to be run after a few hours. So I will score it 20. And I need to check the medication. Just a minute, sir. I will check the medication for your fall, if any medication which leads to fall, because as you are a hypertensive patient, so you might be on the antihypertensive medication, so which can lead to fall. Because what happens is, sir, that hypertensive level of BP is very much high. So the medication which you are taking, it can make your blood pressure low. So it can lead to dizziness, sir. So it can lead to fall. So I need to check it. Okay, so I will score it over here 20 then. So to see your gait, if you don't mind, can you walk from here to there?
Sure.
All right, sir. I will help you out. Slowly, sir. Right. Okay. Right, you can turn. Okay. Sustaining. Slides. I can see that you are having the flank pain, and due to that your gait is little bit weak. Yes. Okay, so I will score you then 10. Sir, as you are not having right now the attender, so if you want to go to the restroom, just press the call bell. We will assist you for that.
Surely I will.
Okay, sir. Thank you. Thank you so much, sir, for this information.
Post-fall assessment. Post-fall assessment guides a healthcare provider to identify the presence of any type of injury in patient after a fall and to prevent further fall. Purposes of post-fall assessment: to identify the root cause of fall, to discover the presence of any risk factors, to prevent further fall.
So what happened? My God! Somebody please come for the help! Code fall, room number 1002, adult, Robia 1, 2, 3, 4, 5.
Ma'am, can you sit better, please?
Yes, yes.
Are you able to?
Could you slide little bit? Are you having any pain in the head or neck region?
Right, man.
Alright, sir. We are so sorry. So wait a minute. Shilpa, check the BP.
It's hurting.
Yes. I can understand you're having the bruises, right? Just make it immobile, sir. Sir. So I need to check your GCS. Hello, sir. Yes, yes. Okay. Are you feeling dizziness?
Oh yeah, slightly.
Okay. Can you move your feet a little bit? All right, all right, all right, sir. Just relax. All right. Okay. What's the BP?
Ma'am, it's little low.
All right.
Please take me to the bed.
Yeah, we will surely. Are you comfortable? Little bit?
Yes.
I can understand that you are having the pain. Are you ready to move to the bed?
Yes.
Okay, okay. We will help you out, sir. We will help you out. Just slowly, slowly. Yeah. We are supporting you. Slowly, sir. First of all, just sit down. Sit down and relax. Relax, sir. Relax. Are you okay? Just don't make it mobile. Let it be like that only.
I need to lie
Can you
down.
lie down? Yeah, sure. Just move it front. Right. 1, 2, and 3. All right, sir. Shilpa, can you go that side? Shilpa, can you hold there? We will make him just little bit. Sir, you have to come. Yes. Like that. Okay, sir. Yeah. Right. Yes, ma'am. Please come. Yes. Please come, ma'am.
I would like to talk.
Yeah, ma'am.
Hello sir, my name is Saraswati PV. I am from the quality team and I am here to conduct the post-fall assessment. So would you mind me asking you some questions? Alright, thank you sir. So first thing, how are you feeling right now? Are you experiencing any pain or discomfort?
Yes, I just had a fall and I hurt my hand.
Alright, I see. I can understand your situation. Do not worry sir, I'll let the doctor know about that and he'll give you something for the pain. Okay? Yeah. Would you mind me recording our conversation?
No.
Alright, thank you. Yes, so what caused you to fall, sir?
Actually, I wanted to go to the restroom.
Okay.
My tail was down.
Okay,
I took a walk and I had a fall.
I see. Alright, so who was the assigned nurse here?
Ma'am, I'm the assigned nurse.
Okay. So why was the side rail down?
Actually, ma'am, the doctor has prescribed some of the medications for the patient. I just intended that one. I just went to take that one. So that at that particular time, I just forget to put it up. So it's my mistake. I forgot.
Alright, so talking about the medication, may I know what all medications he's been put on that caused his dizziness?
Ma'am, patient is on some of the antibiotics as well as the patient is on antihypertensive medication. Today morning, only the dose was increased by the doctor.
Alright. So has anyone witnessed the fall?
I didn't witness the fall, but I heard the sound, so I just came in and he was in the floor.
Okay.
And he's not having any head injury or neck injury as he's saying. He's having a little bit of bruises in his left hand.
Alright, so I'll be taking a leave now, sir. I'll have a word with the nurses. The doctor is on the way, do not worry. Do you have any questions before I leave?
No.
Okay, sir, thank you. Please come. So you must have known by now that there are certain fall prevention measures that need to be taken in a hospital for patient safety. Like whenever the patient is alone, please make sure that the side rails are on, all the four, when you leave the patient. And also please make sure that there are no obstacles on the way in the commonly used pathways, especially in the patient room. And also please make sure that whenever the patient wants to move out of the bed, he or she gets some assistance. Okay? Yeah. I'll arrange a teaching session for all the nurses in the unit, so that they are aware, and in the future it can be prevented, these type of situations. Yeah, sure.
Hello sir, I'm Dr. Ambika. Sir, how are you feeling right now? Are you comfortable?
No.
Okay, can I see your hand? So I can see the redness and swelling is there. Okay, keep it down. Okay. Sister, I'm prescribing some analgesic medication to the patient. You can give the medication according to the chart.
Okay, doctor.
And I'm advising the x-ray also of the left arm. Okay, so you can shift the patient to the x-ray room. Okay?
Sure.
So have rest sir, take care, okay?
Hello sir. Good morning. My name is Robia. I'm your assigned staff nurse from 8 a.m. to 2 p.m. May I know your name?
Nikhil.
Okay. Sir, I need to do the fall risk assessment. Shall I? Okay. So do you have any history of fall?
Yes, I had a fall and you are back.
Alright sir. So I will document it that you are having an history, so it is 25. Fine sir. I think IV line is going on. It is stopped. Okay. So I will rate it 0. Sir, your gait is I think normal, and you don't have any ambulation aids also. So I will rate it 0 only. Alright sir. If you want to use the washroom, you can just press the call bell. Thank you sir for the information. So what happened? Please come. I will take you to bed. Come. Just lie down. I can understand that you are having the pain. I will call the doctor for this. I think nothing is that much. No, I think vitals are stable. Let me document. Then I will call the doctor. Alright. So I will call the doctor and will come back.
Key points to remember. Fall risk assessment should be checked for all the patients who are admitted in the hospital during the initial assessment. Collect the correct data related to risk of fall from the patient to plan out the intervention. Educate the patient regarding fall prevention strategies. During post-fall assessment, follow these steps. Record vital sign and neurological observation at least hourly for 4 hours and then review. Continue observation at least every 4 hours for 24 hours, then as required. Notify treating medical provider immediately if any change is observed.
Through this video, you have had the opportunity to learn the latest practical clinical skills used by healthcare professionals for providing the highest level of patient care and satisfaction.